What's up, everyone? How's it going? Welcome to another live with Nekky Jamal's show. And, today I have the honor of bringing on a really close friend of mine to talk about something near and dear to all of our hearts. And that's volunteering in developing countries, sharing your dental skills. And this is the dude I go with on every trip. He's kind of like my better half because I love this guy. So Shane Van Biezen out of Golden, BC. Welcome to the show, my man.
Hi guys, thanks for having me, Nick. I appreciate the invite.
Yeah, now Shane's more rural than I am, and your internet connection is worse than mine. So he's still using dial-up. I
Yeah, we
like it.
don't we don't we don't get great connection out here in the mountains, but we'll try our best.
No, it's awesome, man. I want everyone to hear about volunteering, about what we kind of do when we go to developing countries. But first, man, share your story with all of us. Where do you live? What's a typical day for you look like? Where'd you go to school? Tell us all, buddy.
Yeah, well, for those of you that don't know me and you're watching the show, thanks for tuning in. I'm happy to share a little bit of my experience with volunteering in these remote areas and going abroad to provide dentistry. But first of all, yeah, I'm a graduate of U of S Dental School back in 2016. Was a great program, a small class size, and our host here was also a grad of U of S. What year though? I don't. You're a little
Two
older than
two
me.
thousand nine,
2009.
two
Wow.
thousand nine.
So
Good year.
yeah. Anyways, really enjoyed it. I grew up in Calgary, and then after high school, decided to go to U of S and really enjoyed the campus there, and ended up doing my undergrad in physiology. And then I was fortunate enough to apply everywhere and get in at U of S, and I got to stay there. And then my dental school years there, and now we practice, or I practice in Golden, BC, which is, if you don't know where that is, 45 minutes past Lake Louise, just off the Highway 1 in the mountains. Famous ski hill, Kicking Horse. If anyone's out there that's skied Kicking Horse before, that's where we
Is
live.
is that where Kicking Horse Coffee's from?
Kicking Horse Coffee's down the road in Invermere, but
Oh,
yeah,
okay,
they
okay.
it's the kind of the name that they took. So
Yeah, yeah, yeah. Yeah, no, I've been to Gold, man. I love it there. It's gorgeous. You live in paradise.
yeah.
It's too bad I hate the
Hmm.
cold and would rather live in Hawaii. But
Yeah,
good
we
for
get a
you.
lot of snow, so
Yeah.
it's fun though. I never thought I'd end up in a rural community. Born and raised in the city, and went to school in Saskatoon, and lived in a big city my entire life. And first moving out to a rural community, it's definitely um, a shock, right? You
Yeah.
see your patients every day at work, but then also at the grocery store, at the coffee shop, at the
Yeah.
movie theater. And it's really nice if they like you, and it's
So
not
true,
so
right?
great if they don't.
Yeah. Because when you're walking down
So I'm sure you
the
probably experienced a
grocery,
little bit of that.
oh, totally. Because when we're walking down the
Yeah.
grocery aisle, if you don't like, if you want to avoid someone, you have to walk super quick, and you're always looking around you. And
Or pretend you forgot that spice.
oh yeah, abandoned
Oh
cart
yeah.
and just
Oh
run.
crap. Forgot that. I'll turn around. But no,
That's the
it's been
downfall of
good. I
rural
mean,
dentistry. Yeah.
yeah, it's a great place to live. We have a lot of fun, and I'm really happy to be here. I purchased the practice in Golden 5 years ago now. So right after school, I wasn't prepared to buy a practice, but the older dentist was looking to slow down and sell, and that opportunity uh, was there for me. And if I didn't jump on it, someone else would have. So right after high school, or sorry, right after dental school, a year later, purchased the practice and started going from there.
Yeah, that's super awesome, man. I'm super proud of you for doing that. I'm excited to see because now you're building a brand new office, and I'm excited to see, your dream come to fruition, and you know, practice dentistry the golden way.
The golden way. That's Nekky and I's office motto, the golden way. Yeah.
Yeah, man.
Yeah.
That's cool.
No, it'll
I'm
be
I'm
good. We're excited to move, and we have the way Golden's growing right now. We have a 6-chair practice, busy every day, and we're just bursting at the seams. So we're adding in a few more chairs, updating some equipment, and just because we're a small town doesn't mean we can't provide big city dentistry, right? So people don't
totally.
have to travel here now.
Yeah. No, man, I think that's so awesome. And I know you're doing lots of IV sedation just like me and taking out lots of wisdom teeth and I'm sure your implants are straighter than mine and you're doing well out in Golden. So good for you, buddy. I'm proud of you. But I want to talk
Yeah,
about
thanks.
volunteering, man. Like we've been on several brigades together. Why don't you share the story of how we kind of got connected?
Yeah, it was my last year of dental school, so fourth year. You and your colleague, your partner at the time, offered a scholarship for fourth year dental students to join you and your group on a brigade or a dental brigade or a tour. So myself and a classmate, we all submitted, reasons why we want to go and why to pick us and choose us and all that sort of stuff. And yeah, fortunately, I was one of those students that was able to go, thanks to you and your partner, your business partner. Um, you provided our ground, you covered our ground costs and all that sort of stuff, and we were able to join you. And our first trip was to Ecuador.
Oh yeah,
Uh,
yeah, Ecuador. Yeah, I
it was
forgot which one was your
Ecuador,
first.
and
Yeah.
Amazon tributary rainforest, living in jungles with grass roof huts and all that sort of stuff. And that
Yeah.
was my first exposure to a dental brigade.
I just remember you coming out of the airport in Quito in Ecuador wearing a button up shirt and like leather chukkas and it's
My
like you're
wheelie
ready.
suitcase bag.
Yeah, it's like you're ready to go to the bar and you're ready to go into the
Yeah,
jungle. And I was like, who the hell is this guy? Who invited him?
I'll never live that one down, will I?
No, man, that
No.
was awesome. Yeah, that trip was wicked. In Ecuador, we went into like the rainforest, and then we went into the mountains in Ecuador too. That
Yeah.
was super cool, man. It was cool like going in the no, I'm thinking of Peru. I get see. Here's the problem. After a while, they all kind of get jumbled together. All the trips, hey?
Yeah.
Yeah,
Yeah. And that was what, 7 brigades ago for me now. Six,
yeah,
6 or 7.
yeah, man. Um, that was incredible. Honestly, Shane, I think it's so cool that every brigade, every single year, we go together. And to me,
Mhm.
that's my favorite part. Is like I know I always have my bro with me, and you've always
Yeah.
been that guy for me, man. You know, you lead the brigades just as much as I do, and I know I can always count on you. So, dude, Shane, thank you so much, man.
That's awesome. No problem. It's become like our little brigade family, right?
Totally, man. What were what are some of your favorite memories of dental brigades?
Um, I mean, there's so many of them, but the excitement leading up to the brigade. Um, we go with Change for Children, which is that organization out of Edmonton.
Yeah.
uh, and they're doing all the planning for us and the groundwork and everything, and getting all those emails several months prior to us taking off is always an exciting part. And then really getting on the plane and at the airport, seeing all your brigade family or friends that go every year, catching up with all of them is always fun. And then yeah, I think just everything to me, I really enjoy immersing myself in other people's cultures, right? So
Yeah.
landing in Ecuador, Guatemala, areas like that, and just being so welcomed by people in the community is always a big heartfelt for me, knowing that they're so appreciative of us taking the time and us showing up to these areas. So that's probably one of my favorite parts, just the anticipation leading up to the trips
Yeah.
and getting there and meeting everyone, and then starting your first day, hitting the ground running, setting up the clinics. is always great.
Yeah, man, it's you're totally right. It's the lead up to it is always my favorite part. We go with, like you said, an organization, Change for Children. They do much more than just like dental trips. Like they drill water wells in Nicaragua. They have food programs in Guatemala, and we try to make these trips as sustainable as possible by not just doing dentistry, but there's always an add-on component. And Nicole Farn, she does all of our like she basically makes the trip happen, and she takes care of all of us when we're down there. But it's really cool that remember when we went to Nicaragua, we were able to fundraise for a water well at the same time
Yeah,
as we did the dental work. Like, to me, that
yeah,
was super cool because we're making an impact more than just teeth,
yeah,
and that means a lot. Hey.
yeah. Yeah. Thanks for bringing that one up too. I mean, that was an amazing moment where you finish off the week of providing dental care and eye care, and then all of a sudden you go to this community and they've never had running water before,
Yeah.
and then you see this water well done, and they're pumping water, and everyone in that community is so excited, and they have their music playing, and yeah, that was another standout moment for sure.
Yeah. No, that was one of my highlights, for sure. And Nicole does such a good job organizing all that. A really cool part I like is the adventures that we get to go on. Cause, like, yeah, we go down there to do dental work, but like, man, we'll climb volcanoes. We'll go, river rafting. We'll, eat all these different foods. We'll go to
Yeah,
communities that have never maybe seen foreigners like us. And you're literally dropped in the middle of nowhere. And, you're just trying to help where you can. And that's so cool. Hey.
yeah. Yeah, yeah, I mean, it's not all about the dentistry. You're also there to experience the cultures and what these countries have to offer, and us planning some downtime and exploring around the areas is always great. I remember, was it Nicaragua? Oh no, down in Costa Rica. Sorry, when we were in
Yeah.
Costa Rica during that turmoil in Nicaragua, all those Nicaraguans fled the country and were
Yeah.
living in Costa Rica.
Yeah.
But then I never seen all those sloth animals, and then going into the jungle and taking pictures and all that stuff. So, yeah, another a great part of these trips is to also explore these areas that, for me personally, I otherwise wouldn't really travel there. Right? You don't really think
Totally.
of going on a vacation, so
I
it's an
don't even
added
think we
bonus.
could get there if we tried. Like, there,
Yeah,
we wouldn't even know where to
probably
go.
not.
Yeah.
Probably not.
So for those of you that have never done or been on a dental brigade before, Shane, can you kind of explain like the flow, like how it works, like people line up, how they are seen by the dentist, what kind of work we do?
Yeah, no problem, man. So Uh, we get there, we check into our hotel, and the organization that we travel with, for example, Change for Children, there's a number of them out there that provide these trips. They do kind of the groundwork in terms of they pre they let the communities know ahead of time that we're showing up,
Yeah.
and then the mayor of that community, right, would gather all the people in that area that would show up on those days, and so we show up to the church, to the community hall,
Yeah.
to the broken down school, whatever it is that they
Yeah.
have with a roof over it.
Yeah.
We show up. We have our portable ADEC units with our
Yeah.
compressor and our power, and we set all that up in about 45 minutes. We find whatever table we can nearby. We makeshift a dental chair or table, if you will, with our garbage bags attached to it and our makeshift pillows for the patients. And if you're a taller person like you or myself, you probably remember your lower back is killing you because you're
Oh
bent
yeah.
over all day.
Totally.
And then we just start seeing patients, so we triage them, right? There's a lineup of people, and a lot of these people have walked from hours away, right? They
Yeah.
don't necessarily live in that community, but they've heard of our brigade or us showing up, so they've traveled numerous hours to come. They line up. We triage them just as we would doing a spec exam or a recall exam. We look through their teeth. We would write on the bibs that they wear which teeth need restorations, which teeth need extractions, and then we send them to the right area accordingly.
Yeah. And then, they either get fillings or extractions or yeah, it's a mixed
Yeah,
bag, hey?
yeah.
Yeah.
So yeah, a lot of people I know. Unfortunately, we can't do root canals there. We don't do crowns. We don't do stuff like that. So it's basic treatment, hygiene, fluoride treatments, and we provide restorations, amalgam, composite, as well as extractions. So
Yeah. No, it's we're just doing like emergent care, and we're getting people out of pain. Dental pain, as I'm sure you've seen by your patients, like it's debilitating. And can you imagine having a full mouth of abscessed teeth? And it's really cool to go to these communities and help see patients that don't have access to a dentist, and you can get a lot of people out of pain quite quickly. And I think that's the benefit from it. Like we both know that this isn't a sustainable activity. Like we are really just providing emergent care, and that's kind of the one, I guess, downside of it is we're there, treating as many people as we can, getting people out of pain, but then we leave, and that's a downside in my opinion. And I've always thought of that as the whole negative of the whole experience. But I think we should talk about that because that's something that maybe not a lot of people think of. Have you ever thought about stuff like that?
yeah, that's always a hot topic when you do these dental brigades or any medical brigade and things like that. Is okay, you extract an upper clearance, right?
Yeah,
And who does the follow up? Who does the post ops? Things
totally.
like that.
Yeah,
So yeah, that's always something that comes up with my discussion. But for me, it's a lot of. I feel we are trending in the right direction. I mean, we do provide oral health instruction. We've made those booklets that are in Spanish so people can read them and
yeah,
understand them. We also provide toothbrushes and fluoride treatments and whatnot to all the patients. We explain things to their parents or their moms, and we hope that they take that information and do what they can with it. But yeah, I mean, in terms of is it sustainable long term, I'm still fighting with that because, yeah, for example, in COVID times, I mean, we haven't been back there in what 3 years, right?
yeah,
So it's a really hard situation. I think that things that we could do as an organization or raise money towards would be, how about finding public health nurses
yeah.
or people in the community that are training for nurses or in the medical field and teaching them how to apply fluoride and teaching them how to do post ops and teaching them how to prescribe properly if they're pain medication or antibiotics and things like that. Also, one thing I thought about is, what about other dental students that are in nearby, right? In a bigger
Yeah.
city or in a bigger center, invite them to come out and spend the 5 days or whatever it is with us and teaching them this is what you do, this is how we do it, and having that conversation. Um, Not saying that they don't learn the North American way, but just making sure that they understand that, hey, if this is walking in your door, this
This is
is
what you do.
how we would treat it, or things like that. So we do, like I said, in my opinion, and is it sustainable? I mean, we do provide, like I said, oral health instructions and stuff, but long term, I think we could improve it for sure.
Totally. And like, man, we've had dental students from nearby villages come with us, and we've always encouraged that. Like, remember in Nicaragua, we had, the public health nurse with us, and in Guatemala, several times we've had dental students,
Mhm.
um, join us so that we can try to at least um, have some sort of follow up when we leave, because we both know that there will be post op, problems, especially when you're taking out teeth and you have no idea what you're doing half the time anyway, right?
No x-rays there.
Man, I remember one time I was taking out a 4.8 on a military dude. and like a soldier, he comes in all of his garb. And those guys always freak me out because everyone carries a machine gun, just walking around carrying a machine
Yeah.
gun, puts the gun
Yeah.
down, points to his tooth, and it's a horizontally impacted wisdom tooth. You can just kind of see the cusp, and you have no idea what you're getting into, man. Like no
No.
idea. And I
Nope.
remember we all had a kick at that one because no one could. We didn't even have the
Yeah.
proper tools to reflect a flap that day, and I was
Yeah.
just
Yeah.
shaking my head like that was just a mess. But regardless, we did
Yeah.
get the tooth out, right? But like, yeah, like we have to be able to have post-op complications. I think that is the downside of what we are doing. But man, think of all the good that we've done.
Oh, I mean, geez, and we see it all the time in, I'm sure in our practices, people walking in with fistulas and draining abscesses and faces that are swollen, like baseballs and all that sort of stuff.
Yeah,
Yeah. How is that? They're in pain. They haven't slept in 3 days, all this sort of stuff. And they come to us and they have nowhere else to go. And we provide that pain relief
totally.
we get rid of that infection and we prescribe our antibiotics and we tell them how to take it. So yeah, we are providing immediate emergency dentistry. And I think there's a huge value in that for a lot of people. Right. So,
Totally,
and
man.
it's free.
And
Yeah.
it's
And
free.
it's free.
That's very true.
And it's free.
Um, the one of the coolest things that I think happened to the both of us as part of our brigades was actually bringing Becca along with us. So Becca is Shane's better half, Becca Colbinson, and
Yeah.
she's an optometrist, an awesome optometrist, and she's like set up the optometry program alongside our dental program. And her
Yeah.
and Phil, another optometrist, he's in Saskatoon now. Yeah.
Yeah.
Yeah. And they come with us every year and they are working longer hours than we are. And they're providing glasses to people. And man, there was so many stories of, man, I saw a kid with like a -10 prescription or something and didn't have glasses. Like -10
Yeah.
is legally blind. I'm -3 and I can't even see. Like, can you imagine? And
Yeah.
Becca and Phil like hooked this kid up and he could see his family for the first time. Like, that's wild. Like that's amazing. That was so
Yeah.
cool.
I'm
Yeah.
really proud of her too. Her and I always wanted to do something together. We both have the same passion for volunteering and dental optometry brigades,
Yeah.
and we're just really fortunate that Change for Children allowed us to work together. And for a whole year, we had people in our community in Golden that would drop off old glasses, sunglasses, stuff that they're getting rid
Yeah.
of. We went to the Lost and Found at the Calgary International Airport, and we ended up getting a ton of donations from the Lost and Found. And
Yeah.
we packaged all those up and took them with us. And she sat there through every single pair of glasses with a machine in her office, and they found out what power it was so that they knew
Yeah.
they could, give this to a certain person. And setting that up was a big task, and they rocked it. And
Yeah, man.
yeah, when we're sitting there done our dentistry for the day and we still see a lineup of people getting their eyes checked, and it's just amazing. And like you said, kids that can't read or can't see, they can't read because they can't see in school and their
Yeah,
parents didn't
totally.
know that,
Yeah.
right? And now they give them a pair of glasses and they can read the chalkboard and they can read their notes, and it's amazing to make a huge difference there too.
Yeah, man. Honestly, I thought that was almost cooler than the dentistry part is, giving someone
No,
sight.
no, I'm biased. I'm biased. Teeth are cooler.
No, man, that was super cool. But like, man, just what countries have we been to together? We've been to Nicaragua, Guatemala. Which is your favorite country?
I really liked Nicaragua.
Really? Yeah. See,
Yeah,
I
I
always go
like
back to
Nicaragua.
Guatemala because Guatemala
Yeah,
was. I love their traditional dress, like their beads and their like traditional clothing.
yeah, all the colors and stuff for sure.
Yeah. No, it's cool. And then
But
like,
I love the ocean in Nicaragua.
oh yeah, yeah, yeah. No, man,
Right,
that's
working alongside the water and all that stuff.
totally. Hey, Shane, have you ever felt unsafe?
No, no.
No.
In all honesty, no. I mean, we also the organization that we travel with, they always provide us with translators, right?
Yeah.
So there's people on the ground that meet us at the airport, and if anyone's listening to this and you've thought about volunteering and going on these dental missions or brigades, you definitely are safe. You stay in safe hotels. You always have your translators with you, and you travel as a group, right? You travel as a pack. So you're always able to understand what people are saying. They help you out. They get you where you need to be. So it's very safe, and I've never felt otherwise.
Yeah. And, maybe it helps that we're both like, 6'5", and everyone else is like, 5'2" down there. And so no one's going to mess with
Yeah,
us. But, yeah, I've never felt, unsafe at all. I've always felt safe, traveling around with Sergio all the time. He's always, protecting a lot of us, especially when maybe we had a little too much rum. But it's it's always it's a fun time. It's safe. I think everyone should at least experience an international dental brigade at least once in their career,
yeah,
because maybe we were so blessed to be able to get an education, and the stars had to align for all of us to get to where we are today. And I think it's almost our duty to share our skills with the world. And I'm sure you feel the same way. Hey.
yeah. It makes a big difference for sure. But as one caveat that I have about that is, you have to have the understanding that you're going to be working in pretty primitive locations, right? Clinics.
Yeah.
Um, you're not going to have your fancy A deck chair that reclines with your LED overhead light, your
No.
booster, to reflect that nice flap and all that sort of stuff. Sometimes you barely have enough air to drill through the enamel for an occlusal filling, right?
Yeah.
So you have to have the understanding and that in your mind that it's not going to be necessarily the easiest on your body, and you may get frustrated, and it may not necessarily be your best work. But again, you're doing what you can, and that's more than nothing, right? So
Oh, totally, man. But the grossest part of the whole thing is definitely the escupe bag, or the spit bag that we tape
I
to
was
this.
I was just thinking of that.
So our dental chairs are basically desks. So we have like, we'll line up 3 desks, throw a garbage bag, put some duct tape on it so we can like easily wipe it off, or we'll use a shower curtain.
Yeah,
But on the side of the
yeah,
bag, like when we're pulling teeth, we don't have suction. So we have this like, extra large, Glad, heavy duty garbage bag, duct tape like 10 times to the side, and it becomes the spit bag. And so whenever,
yeah.
someone's mouth fills with blood, they turn to the side and they spit. And, you know, Shane and my Spanish is elementary at best. So we're always saying like, escupe aquí, escupe aquí, and it's like spit here. And oftentimes
Yeah.
they miss and they'll hit your shoe.
And
And
we all know that how easily gums will bleed if they're inflamed, and if patient
yeah,
has gingivitis and you just look at the gums and they start bleeding. Imagine trying to reflect a flap to
yeah.
get out a broken root tip, how quickly their mouth fills with blood. So
Oh
about every 2 minutes you're asking them to spit here,
yeah.
spit here.
No, it can be that.
But
Hey, and since you brought it up, one common misconception is that we use expired products. And that's actually something that quite frustrates me, is when people say, and they do it out of the goodness of their hearts. Like, other dentists will call me and they'll say, "Hey, Nekky, I have some expired composite, or I have some expired lidocaine. Take it with you on your next trip." And to me, I'm like, if you're not going to use it in your own clinic here, just because the people are in a developing country does not mean that you can use expired products on them. They're still a person, man. And
yeah,
that's always
yeah,
been a sore point for me. So when people, I don't know, I I I always like to use the same products I use at home. I bring it out of my office and I take it down there. And I know you do the same. But have you had lots of people telling you like, "Hey, Shane, take some expired composite with you"?
No, not in Golden anyway, but
Oh
I
yeah, it's a
just
small community.
my mentality is that, we treat you treat the person, right?
Yeah,
Not a tooth. So just as we would in our own private clinics, we make sure they're frozen, we let it settle in for, I don't know, a good 5 minutes, we test it out, I do the same down there just because they can't maybe speak the same language and understand you, but you just make sure that they're nice and frozen, they're comfortable. Um, and that was the hardest part on these brigades is the language barrier.
yeah. Yeah, I wish my Spanish was a little bit better. It's like we always take Spanish sessions before we go, but then we don't use it all year. You know what I mean? And then you get back
Yeah,
down there and you're like, it's hard to form a sentence. You can understand a little bit here and there, but you're almost just like, man, just slow down.
yeah.
One word at a time.
If any, if anyone's watching and you can speak Spanish, we need you.
We need you to
And
give
that's hard.
lessons
And
to
that,
us before.
yeah, that's hard. That was a real tough thing for me, and I had to learn to adapt, of course. But you can't talk to the patient as you would talk to your own patient in your clinic, right? How are
Yeah,
you doing? Are you okay? Does this hurt?
yeah.
We're almost done. Things like that. You can't reassure them. You can't calm them down because you can't speak the language, right?
Oh, totally.
And that's still that will forever be a difficult thing for me because I can't speak the language. But again, with translators and stuff, it makes it a little easier. But yeah, it sucks not being able to calm a crying kid down when they just see this random person standing over top of them, and they're about to get 4 or 5 primary teeth extracted, and they don't know what's going on, right?
Yeah,
So
yeah.
yeah,
And
it's definitely that's the hardest part.
I always like think of it like, as if we were going to go see the dentist in school, right? So we line up in school, and then there's these dentists that come in and maybe they're Korean or whatever, and they
Yeah,
can't speak my language, I can't speak theirs, and you're just looking up, hearing some guy yelling at you in Korean, like, "Hi, how are you? My name is whatever," right? But we don't understand
yeah,
that. And I had this dream that this
no,
was happening, and I'm like, this is what they're going through, even though we think we're being so nice and like, we smile with our eyes, we're still wearing masks, right? But it can be
yeah,
so intimidating for these poor little kids. Like, first of all, they've never even seen like a foreigner before, like us. And then here we
yeah,
are, these two tall dudes coming in their school
yeah,
being like,
exactly.
you need 5 teeth out. Let's go.
Yeah,
Yeah. Like it must be
yeah,
so
I
tough,
know.
right? Yeah. But it's part of the game, and we are trying to help wherever we can. Are there any like do you think volunteering is for everyone? Like, um, is there certain situations that you've been in that you feel like this isn't what I signed up for, or do you wish, like, have you ever been like down south at times in Central America, and you're
Um,
like, this is not what I thought it was going to be?
I have a strong passion for volunteering, so I think that um, I would argue that if you're doubting yourself, I would encourage you to volunteer.
Yeah,
Doesn't necessarily have to be on an international dental brigade. Volunteering in your local community, right?
yeah,
Volunteering in a northern community in your own province. Going up to Yukon or Northwest Territories in Canada, right? That's a little closer to home. You're going to get the same experience. So not necessarily volunteering for an international dental brigade, but I think as dentists, and again, this is my personal opinion, but um, we have a duty to share our skill and our knowledge, and we try to do the best we can for our community, and giving back to our community, I think, is part of our role as prominent members in the community and healthcare professionals, is doing what we can and volunteering, whether it's in a local setting, a global setting, whatever it is, but somehow giving back and enriching the life of others is always something that we should strive for.
yeah. I man, you're nah, this is why I love you, Shane. You always know the right thing to say.
Yeah.
No, no, that's cool, man. So
But I
I've
don't necessarily like, yeah, elaborating a bit, I guess the international. dentistry, it may not be for everyone, and
Yeah.
people might get frustrated and stressed out and, not really enjoy their time there. But yeah, you don't have to go international. Just stick in Canada or stick in your province.
Yeah. No, I hear that. And, maybe the accommodations may be a little better. I liked how you used the word hotel earlier. Like, we roll into our hotel and I'm like, what hotel is this guy talking about? Because
Yeah,
I don't think I've stayed in anything that resembles a hotel. It's usually like, a room with a bunk bed. Or in India, when
yeah,
we went, like, man, we literally went like 2 weeks before COVID. Like, we got home from India. That was February. Was that February 2020? Yeah, February
yeah. End of
2020.
February.
Yeah, the hotel we stayed in there, we figured out that they were renting our rooms during the day for some sort of, maybe hourly activity. And, you know, I don't want to sound graphic, but I'm sure everyone knows what we're
Yeah,
talking about. And no, we stay in some pretty interesting places, but like, look at the stories that we get. Look at the adventures that we were able to have as a group. And it was so much fun. And honestly, man, I can't think of a better person I would share those memories with other than you. You've been such a great friend and partner to have along on these brigades. And honestly, man, I can't thank you enough because you've always been a true leader to everyone, and you've made such a huge difference. So I look forward to
thanks, man.
so many more trips together, man.
Yeah, we got to get back out there. I mean, we'll see how the next year goes, but I'm chomping at the bit to do another brigade for sure.
Yeah. You have to bring Ellie with us. She's Ellie's one. Not, how old is she now? She won. She just had her
Almost
birthday.
one. Yeah,
Almost won. Almost
almost
won.
one. Yeah,
Yeah, she's. I love her running around the villages and having the local moms just take care of her because that's happening, man.
yeah,
Yeah. No.
probably.
No, that's cool, man. Shane, is there anything else you want to add, buddy?
Yeah, I just want to share some pictures
Oh, sure, man.
before you kick me off your show. I think if we can share a screen, it's really
Yeah, I
cool
got
to
you.
see some of the setups that we have, and it shows anyone watching or going to be watching the show what to expect if they do want to get into a brigade. So
Yeah,
if you can share
your
my screen,
screen's up.
I'll
You betcha. It's up.
okay. I will slide through a few images here.
Yeah, I can kind of almost see the
Um,
thumbnails now. I know that's Guatemala right there. Yeah, click on
yeah.
some of these pictures. Show these guys where what it looks like there.
So this is a typical case that you would probably see in these rural settings or remote settings. So this was in Guatemala. Patient shows up, and this is what their mouth looks like, right?
Yeah,
And you're sitting there thinking to yourself, "What the heck?" And they live with this every day, right?
yeah, man.
Imagine your son or daughter going to school with a mouth like that. Now we probably realize that that's some sort of enamel defect where that's the dentin of the teeth. But what do you do in that case? Because that family can't afford 20 crowns, right? They
Right.
can't get crowns on every single tooth. So we try our best to explain that to them. Here's just another kind of blurry close up.
Yeah, man. Our Instagram
So
game
there's
is
the
weak.
here's another close up of the lower arch, right? Every single tooth.
Yeah,
So yeah, that kind of makes you really feel for the family and for the kid. Here's another case, a typical kid showing up. You see the two, they're probably what here? They have four anal anteriors, so there's eight, maybe a little younger, seven. But look at every single tooth in the upper and almost lower arch. Primary tooth is decayed right to the bone, right?
I find it
So
quite
again, that's
I find it quite interesting that this is the most common scenario that we see. It's always the upper anteriors,
I know,
like right to the
yeah,
gum line, and then you can already see the decay starting on the D's and E's. And this kid is probably 4, and
yeah,
it's the most common thing we see. And there's always like the mom is saying this kid is up all night, take these teeth out, but the kid is
yeah,
4 and needs probably 16 extractions, and obviously we can't do that,
yeah,
right?
right. So yeah, and it really challenges your decision making because you have to try and think of how can this patient get the best care and what's going to provide them with the best long-term outcome, right? If
Yeah.
you look back at the this picture here, that's their 3-6, right?
Yeah.
That's decayed, so they're going to lose their adult permanent tooth.
Yeah.
Um, and it's just far too common in these remote areas.
Yeah.
And I'll have a few more here. This was a really nice case that I always remember this young girl.
Yeah.
She was going to school. She was embarrassed to smile, never wanted to show her teeth because of the mesial decay there on each central, and they didn't know how to fix it. Um, and that was really fun. We worked our magic, and of all of us know, some composite filling, some polishing,
Yeah.
and she's back. And when she saw her teeth for the first time, she started crying, and gave me a big hug. So that made it all worth it for that week right there.
Yeah, man.
Some of the these are great. I won't take up too much more time, but these are some of the areas where we're working. So here's our sterilization center.
Oh man, I
You can
totally
see
forgot to
the
talk about steri, because
oh,
that's
yeah,
another common misconception is like we don't clean our instruments, but we do. We
yeah.
just don't bring our ADAC. What are those things called? The leases.
The
Yeah, we don't. The
statums and
statums
yeah.
and leases. Yeah, no. So numerous studies have been made on how to properly sterilize instruments in developing countries, and there's these special pressure pots. If you can see them in the background there, Shane, talk about those.
Yeah, so that's just your basic camp stove, and there's a pressure cooker, and we get the water to a certain temperature under
Yeah,
pressure, so it heats up quickly, and it sterilizes all the hand tools, right? So we throw our extractions and our extraction sets and our Minnesotas and our elevators and forceps and all that in there. And then
yeah,
in these wash bins, we also have our cold water bath, and then we also transfer then the instruments to a kind of a disinfectant liquid,
yeah,
and that's how we wipe everything down. So we
totally.
transfer it from the pressure cooker to our cold water bath, and then we reuse them. So yeah, we provide the best sterilization that we can, and it's been proven in the literature to be effective for sure.
Yeah, and
Here's a
that's
classic
oh,
setting in terms
here
of
we
a
go.
operatory.
No, go back. Yes, this is what I'm talking about. The garbage bags on the table.
Yeah,
Show everyone the scoop bag. Right down there in the lower
yeah.
right hand
So
corner. The spit bag.
if you can see my cursor, that's the Escupe Yaqui bag. So that just gets filled up with blood throughout the day.
It's so gross.
You can see our portable A deck carts,
Yeah,
and no cushions for the patients. And that's a shower curtain that we buy at the local dollar store and duct tape it to the table to wipe the table.
yeah,
And behind us there against the wall is all our sharps containers for our needles and scalpel blades, and then our amalgamator and composite and stuff like that.
yeah.
So if you can see that there, that's probably at Nekky's waist when he stands up. So
More
when
like
you're
my
sitting there
knee,
for
but yeah.
4 hours a day, bent over or your knees, yeah, doing extractions or fillings, you're bent over there, or you're working from a kneeling position. So it can get quite tiring or taxing on your body for sure.
Oh, totally, man. I remember
And
one time
these are just cool photos.
I stacked two tables on top of each other, but it was so like,
Yeah,
shaky, but at least it was like, proper height that you could pull teeth, and I didn't break my back that day, but like it is so hard on your
right.
body. Oh
And
yeah,
there's
the
all the
lineups, hey?
local community kids lined up, so you can see their bibs. They're waiting to have their teeth worked on or fixed up.
Yeah.
And then just a little bit of fun. This is a great photo of a young mother and how they carry their kids,
Yeah, that's
or
Guatemala, man. I
with
love the
their
colors that they
typical
wear,
dress
man.
on. Yeah,
Yeah.
yeah. So it's really fascinating, and it's a great way to immerse yourself in the community, treating patients, and they really, really, even though they can't say thank you, that they appreciate it by giving you a big hug. So
Yeah.
yeah,
Man,
that's just some of
it's
the pictures in some of the areas that we go to, and I mean, there's the views outside community center where we were working. So you can see the Guatemalan highlands there, and the sun so high beaming down on all the houses and in the mountains. So it's quite amazing.
Man, I can't wait for the next trip. This is man, you just pumped me up. This is
Getting
awesome,
you
man.
getting you fired up.
Yeah, man, this is
So
that's super cool, buddy. Dude, Shane, thank you so much for coming on the show. If anyone is interested in joining us on a brigade, we go with Change for Children, which is a NGO based out of Edmonton. But you could always go with Kindness in Action, which is also based out of Alberta. I've been on several trips with them. They do multiple trips a year. All are good, man. Like, just do what you can where you can and use your skills. And as Nicole from Change for Children always says, we all have the ability to change someone's today, someone's tomorrow, and someone's forever. And I will never forget that. I always, I can't thank her enough for teaching me all these things. And she taught that to you too, Shane.
you bet, man. So
Yeah.
thank you for having me on, Neck. I really appreciate it. I love sharing my experience and stories about these trips. And if anyone sees this and they're ever interested, reach out to myself or Nekky, and we'll get you in touch with the right people. We'd love to have you. We're always looking to expand. And thanks so much.
Yeah, man. Shane, I love you, buddy. We'll chat soon. Have a great day, everyone. See
Keep
you next week.
keep smiling.
Keep smiling.
Bye.